Okay, I think I'll get started so that we don't miss out on too much time. We've got so much content to get through today. Good morning and welcome to the first CMHDARN webinar for 2022, the launch of the Co-production Kickstarter. My name is Katie Sam, and I'd like to begin today by acknowledging the traditional custodians of the lands of which we all are meeting, and pay my respects to elders past, present and emerging, and extend that respect to any Aboriginal participants present. Thank you so much for joining us today. There has been fantastic interest in today's webinar, which is not unfounded. For those of you who are new to CMHDARN, CMHDARN is a collaborative project between Mental Health Coordinating Council and Network of Alcohol and Other Drug Agencies, which aims to broaden the involvement and build the capacity of the community mental health and alcohol and other drug sectors in practice-based research and promote the value of research and evidence-based practice within our CMOs. Today, we'll be hearing from 4 fantastic panelists, Dr. Jo River, Brett Bellingham, Foxlewin, and Dr. Grenville Rose. They are the co-authors of the Co-production Kickstarter resource, and they'll be sharing with us today the significance of co-production research for our sectors. We're due to finish at 12:15 today, and this webinar is being recorded for you to access later if you're unable to stay for the whole event, or if you're so excited by it and you need to share it with your peers. If you have any comments or questions, please feel free to put them in the Q&A function, and we'll endeavour to try and answer them at the end of the event, or we will answer afterwards if we're short on time. I'd now like to introduce our first panellist for today, Dr. Jo River. Dr. River is a conventional researcher at UTS, specialising in mental health, community development and participatory research methods, including co-production and co-design. Thank you so much for being here, Jo.
Thanks, Katie, and good morning. It's good to be here today. Yeah, I guess I'd first like to acknowledge that I'm on the unceded lands of the Gadigal people of the Eora Nation and recognise the Gadigal people's continuing connection to the land, water and community, and pay my respects to elders past, present and emerging. I'm a migrant settler from Europe. My family live in Gibraltar and I have Scottish, Irish and English ancestry. And in the context of my work, I'm also what the Co-production Kickstarter team and Katie introduced me as a conventional mental health researcher, which is to say I work from a position of educational expertise rather than lived expertise. So just to give you some background, I'm a social scientist and I'm I guess, a public health practitioner. And my research work is mostly participatory, grounded in community priorities and carried out in continuous partnership with people with lived and living experience of mental distress, alcohol and other drug use. And that's through all stages of the research process. So I guess when I say participation and thinking about participation, it really sits on a continuum. And we outline this in the Co-production Kickstarter, but it's from exclusion of people with lived experience to people with lived experience being brought in as subjects, where they are recruited as participants in a research project, to what has been described as tokenism, where people with lived experience are consulted but have little influence over the research strategy or process, and through to high-level participation, where researchers work in partnership with people with lived experience. So when I talk about my work, I'm talking about that high-level partnership, which is not only linked to improving the relevance and quality of research, but also makes good on calls from disability and consumer movements for nothing about us without us. In the context of research, that call really seeks to rectify what we might think of as historical epistemic injustice or a knowledge injustice or disparity related to the exclusion of people with lived experience from research and the flow-on effects of that to services and policy. So my work uses a community development framework, and I seek to resolve how, as a research community, we can get from here, which is largely tokenistic involvement of people with lived experience, to their high-level participatory research and using approaches like co-production and possibly make this a new normal in mental health and alcohol, other drug research. So while government agencies, one of the things we first came across is while government agencies such as NHMRC recommend participation of people with lived experience at all stages of research, researchers often provided very little support or guidance around what would constitute high-level participation and how to do it. So the Co-production Kickstarter was created in response to the recognised need for a resource that could support this to happen. So I'd like to talk about why co-production for the Co-production Kickstarter. Well, I guess worldwide there are many collaborative research approaches. There's co-design, co-inquiry, participatory action research, co-construction, lots of different words and terms. And collective dialogue as a way of knowing and doing is also not new, and fostering accountable and collaborative working relationships is deeply embedded in Indigenous cultures, including Aboriginal and Torres Strait Islander culture. While there are different approaches, some share some common elements, but each also has a really different history and influence, different commitments and implications for practice. So in the literature, co-production has been referred to as the gold standard of participatory research. I guess it's been called that because it articulates and centers a continuous partnership, which is equitable and reciprocal between people with lived experience and conventional researchers, and through all stages of the research process, including the planning, the designing, the conducting, dissemination, and reflection on findings with community members. So I guess that distinguishes it from co-design, which is currently the buzzword in health services, as co-design not only has a different history and commitments, participation is not necessarily continuous and can be in one or more stages of the research process. Although I really like to acknowledge that there is more of a push for substantive co-design that more closely resembles co-production. So the term co-production has been attributed to Elinor Ostrom, who was a US professor of political economy and colleagues of Elinor Ostrom, who in the 1970s were concerned with the increasing detachment of public institutions from citizens' everyday lives and knowledge, which is something I think we could relate to currently in our culture. And the citizens in this context were being cast as passive consumers rather than active agents and knowledgeable partners in the production of goods and services. And Elinor Ostrom argued that this wasn't really a positive impact for institutions and organizations, because losing that connection lost the really important knowledge that was vital for effective functioning. Later, Edgar Kahn, who was a law professor, outlined the specifics of co-production and incorporated many of the things we recognize in it today, the principles of community development, of equity, social justice, reciprocity. Kahn also emphasized co-production as both a process of justice, doing justice, and a means of making justice. So meaning that the democratization of knowledge itself and partnership with citizens, particularly those who are the most marginalized, is in itself an act of social justice. And then co-production is also a means of justice making because it pays off, as it's more likely to lead to socially just action that benefits marginalized people as well as organizations and institutions. So this isn't just about lived expertise. Kahn also saw a place for educational expertise in co-production, but wanted to shift the relationship from institutional or organizational power over citizens and the idea of citizen dependency on expertise to that of a mutual, respectful and equitable partnership where the living knowledge and skills of citizens, as well as professionals, was central in decision making and action. So the co-production research framework that we developed is consistent with principles of co-production as envisaged by Elinor Ostrom, Edgar Kahn and others, as well as aligning with long-held advocacy efforts from disability and consumer movements. It involves continuous equitable partnership with people with lived experience, where people with lived experience are central in all aspects of the research process. So I guess I hope that's a useful background to the initiative, and back to you, Katie. Thanks.
Thank you so much, Jo. It's so interesting learning about the history and particularly the kind of social justice origins of co-production. I would now like to introduce our next panelist for today, Brett Bellingham. Brett is a lived experience researcher at the University of Sydney who works across health, education and community sectors. Thanks so much for being here, Brett.
Thanks, Katie. So I'm going to talk a little bit about some of the principles that support co-produced research. I'm a person with lived expertise, so I'm a lived experience researcher. That's what we call it in the Kickstarter. And I think that speaks to one of the principles of co-production, which is sometimes written as seeing people as assets, which feels a bit gross to me. But I think what it's inviting us to do is to really see the skills, knowledge, wisdom, and expertise that people bring, whether that's from a learned experience background like Joe was speaking of, or a lived experience background like I'm speaking from. It's about recognizing capacity, and not just in individuals, but also in communities. So I'm going to talk about, as I said, I'm going to talk about some of the principles that support co-produced research. I think many of these principles are common to other collaborative approaches, whether that's in research or service delivery or education. So some of them won't be new, perhaps some of them will be new. Also, not intending this to be an exhaustive exploration. I think one of my favorite things about the Kickstarter is that we were able to curate a great selection of sources for further reading. And if you're interested in taking a bit of a deeper dive into the principles, practices, and sort of philosophical background of co-production of research, I really recommend you check those out. So I guess I feel like Joe did a pretty good job of introducing co-production in research. And when I'm talking about co-produced research, I'm talking about research undertaken through a deliberate and intentional collaboration and partnership between lived experienced researchers and conventional academics throughout all stages of the research process, what we've in the Kickstarter called the co-planning, co-designing, co-conducting and co-reflecting phases, which in and of itself is a principle that's really important to mention, and Joe mentioned it a couple of times, that co-produced research requires that continuous partnership between conventional and lived experience researchers from the outset right through to the end of that research process. We talk about that in some depth in the Kickstarter, so I don't want to get too deep into, I guess we could call it spoilers, and given how research is largely organised and funded in Australia, this is also a big challenge, and I'm sure we'll talk more about that throughout the webinar today. I think I used the word partnership to describe the working relationship within a team of lived experience and conventional researchers working towards that co-produced model, which brings up a couple of other really key principles and practices that are important for elevating collaboration to the quite high bar set or asked of us by co-production. One is flattened hierarchies, and I've written here acknowledging and addressing power differentials, by which I don't mean sort of wishing away power, but really making power work for the team. For conventional researchers, often that can mean hearing how the power afforded to you by your position is being felt or experienced by others. And for those of us coming from a lived experience background, it often means managing a lot of risk and uncertainty, finding ways to speak up about things that feel unspeakable, and perhaps being willing to dissolve a partnership if it becomes truly unworkable. Sometimes that's the power to say no thank you is the only power left to us. I also use the word relationship, and co-production research is definitely a relationship, and requires a lot of attention to that relational space. Sometimes when I talk about this, I think people get the sense that I'm meaning it is in it's about being nice, and that's not what I'm intending. Even though I hope that we are nice to each other, I think it's really about taking time to build trust and find ways of working together that suit the team and will help the team define and meet its own goals. Another principle, which sort of speaks to another principle, which is sort of capacity building, which is really sort of similar to seeing that people have skills, but it's also about supporting people to try out new things, whether that's from a lived experience perspective, trying out, maybe chairing a meeting or setting an agenda or doing a particular kind of research, or for a conventional researcher, being supported to develop their capacity to facilitate some co-produced research. I think that one thing that Joe and I have found in our work, that the use of wider networks or co-learning spaces is really vital to supporting people to take those steps into meaningfully co-produced research. I think that's something that brings up for me is that idea of networks and communities. That our research takes place, a principle to keep in mind for co-produced research is that our research is taking place in a context. I think it invites us to take sort of an ecological perspective to the work that we do, and that these relationships might not just exist within the short time frame of a particular process, but perhaps should be built up over longer periods of time and sustained. That really helps create research that's meaningful for communities. I guess that idea of meaningful research brings up for me that historically and even today, research has been and largely is conducted on people with lived experience, on our lives and experiences. They're dissected, data extracted, analysed and assigned meaning, and then transmogrified into knowledge by academics and institutions, often primarily for the benefit of academics and institutions. And apology if that's hitting a little too heated or political for you, you might want to strap in. I've still got about 5 minutes. And it speaks to what for me is an underpinning principle of co-production of research, that knowledge production is itself a political act. And just as you couldn't authentically research any aspect of contemporary Australia without acknowledging and grappling with the continuing legacy and effects of colonisation and colonialism, we can't meaningfully research, let alone research in co-produced ways in the areas we call mental health or drug and alcohol, without acknowledging and grappling with the continuing effects of saneism, criminalisation, and epistemic injustice. We cannot separate science or knowledge from the social context of its creation. That's Kuhn and Latour and Ostrom and Kahn and dozens of other people recognised as proper researchers, but it's also many of the lived experience researchers that I've met in my work, Yvonne, Scarlett, Rua, Chloe, and even more, it's people with lived experience who would never call or consider themselves researchers at all. John, Rick, Sarah, who would use very different words but mean the same sort of thing. That game is rigged, or it's not for us. So I know that as researchers, we're all mindful and deliberate about ethics. And I guess what I'm arguing for here is that there is an ethical obligation to move towards co-production and research. That meaningful work, meaningful scholarship, co-produced research seeks to confront these entrenched power differentials. It works across difference and brings together lived and learned expertise. It makes a space where it can be for you if you're interested, to both unpick or critique existing knowledge that perpetuates discrimination, but also to produce new understandings and wisdom that might help us create new and different and perhaps better worlds. In practice, this can mean that co-produced research is deeper and richer, the questions asked more pertinent, and that its outputs better meet the needs of communities and impacted individuals, which sounds to me like things worth striving for. Thanks, Katie.
Thank you so much, Brett. Hearing your passion and advocacy for Co-production Kickstarter is such an honour and a pleasure, and I'm sure everybody has found it so interesting. So I'd like to invite our next panellist to join us today, Bradley Foxlewin. Bradley is a lived experience practitioner involved in co-production research and consultation, community education, and peer supervision. Bradley is passionate about elevating lived and living experience in research and practices of inclusion. Thank you so much for being here, Bradley.
Oh, good morning, everybody. And thanks, Katie, and thanks, Brett, and thanks, Joe, for your previous comments and setting this up really beautifully. I also want to acknowledge that I'm coming from, I live in Ngunnawal country, and currently I'm on Dharawal land out here in Campbelltown. Interestingly, doing a training with a whole bunch of really cool people who are looking to do co-production within a thing called the I Am Youth Aftercare Project. So I just want to acknowledge those folks as being well and truly involved in this work. And I'm going to share some slides in order that I can talk to some of the methods that I've been a part of in regard to doing co-production research. So I'll just do that now. And I'll just make sure that they're up on the screen, if someone can let me know that they are.
They're up, Bradley.
They're up, awesome. So yes, acknowledge country and pay respects to elders past, present and emerging. I want to talk about a little bit about lived experience friendly methodologies and the action of co-production that I've been involved in, both in research settings and in consultation settings, because as I said, I'm a lived experience practitioner who sometimes gets the opportunity to do research and but often am involved in consultation that wouldn't be understood as purely research, in that it doesn't involve an ethics committee. It's more consultation within the CMO sector and things like that. But I think they're both valid approaches. So I'll just click on to the next one, if I can. Okay, I think that one's up. This is a project that I was working with back around about 10 years ago. That talk to the experience of community learning and people with lived experience coming into a landscape of being understood as being knowledge holders. And it was a map that we entered into over a period of a 2-day workshop to look at some of the issues that were that promoted exclusion and some of the ways towards approaching being seen as a knowledge holder across that process. So this was a map that a young person identified their process through engaging with the workshop group and approaching community and accessing community as a knowledge holder over a period of 2 days. And it shows up, the legend that's on the bottom of the page points to fear of rejection and disapproval in the landscape. And that the ideas of fun and enjoyment and inclusion featured as what might be termed kind of like strange attractors that got people across the landscape from working within a research group opportunity, and how that might situate them as knowledge holders over time, given inclusion strategies, discussions about issues of power, involvement, sense of belonging, all of those features that are supportive of people feeling socially included. Okay. When I first started doing co-production research, it was quite accidental. And it was in the context of working in the acute ward at the Canberra Hospital, looking at the reduction of seclusion and restraint. And during that time, there wasn't a lot of conversation around co-production. At least we didn't understand it that way. And the process that we entered into was more of an ethical imperative to reduce seclusion and restraint in acute settings. And how that came about was that I was able to access, and the Mental Health Consumer Network in the ACT was able to access and support a research project that was a lived experience-led research project on reporting on how seclusion and restraint was reduced in the acute mental health ward from a figure of around 16% of stays down to a figure of less than 1% over time. And it had so much of the values coming out of a social ecological approach, something that Brett mentioned earlier, featured as actual co-production in that environment, in that it was a collaborative process and a partnership between mental health nursing, psychiatry, lived experience practitioners and advocates, wardsmen, psychology, and anybody and everybody who was involved in the actual day-to-day of workings within the acute setting. And that piece of research was ethically approved through ACT Health, and has been seen as a powerful step in regard to co-production research and the reduction of seclusion and restraint. But it came about quite accidentally. It wasn't kind of on the back of co-production movement forward. So this is a kind of like a historical account that situates it as early days. More lately, I've been involved with working with community managed mental health organisations in doing co-production research to support people who access services to have more of a voice within CMOs and NGOs. And a lot of the work that I've done has been, and a lot of the work that I've been involved with has been very much on the ground, hearing from people from mental health, intellectual disability, young people who are accessing Youth Aftercare Project, and doing consultations in such a way that is very hands-on, using methodologies that are friendly to the cohort of people that I'm working with, which means that actually sitting with people and working out how might we go about answering any particular question, and even prior to that, what are the questions that we're seeking to answer. So it gets to a very grassroots, hands-on kind of approach, and this is one of the images that was developed around that process, where people used art forms in order to kind of represent what it was that they wanted. And the method chosen was particular to people's expectations and their ways of telling and knowing about particular situations, and ways that people could come to their voice in regard to co-production, given the history of social inclusion that has been a part of the research sector thus far. So choosing methods that actually situate people in such a way that they get to tell about their lived experience, including practitioners and people who are accessing services and people who are in support roles, is one of the key features from my standpoint that allows for people to come into the process in such a way that they get to speak about their lived and living experiences. So we're actually about creating settings for listening. Another example that I've been involved in is using forum theatre as co-production research. And this is an image that, some images that were taken as part of a workshop investigating and part of a research project and a report to write about the experience of how disgust and toxic shame impacts therapeutic alliance in mental health, intellectual disability, and a bunch of other areas, which was a whole bunch of practitioners who designed, theatre practitioners and myself and other actors in the space, designing how we might do this thing, and then actually articulating and reporting on what happened during that process. And some of the rich data that fell out of this particular process from an embodied knowledge perspective was quite profound and maybe wasn't even accessible in any other way. So it's just an example of what can be achieved. The next slide I want to show you, I think, is one of the most important slides. And this comes from the work of my work in New Horizons in collaboration with young people. Over the last 18 months, the Ministry of Health provided funding to provide a service environment that supports young people who have experienced suicidality and significant self-harm to access services. And this is one of the first and only occasions that I've seen where the co-production element of the work has preceded the service model. So for the first 6 to 9 months of the process of establishing what is now called the I AM program, the efforts were put towards co-production, which basically meant hearing from young people predominantly, but also service providers and clinical supports and clinical advisors as to what might be the way forward for young people struggling with these particular issues. And that is, to my mind, and I've been around a fair bit since the early 90s, one of the first times that I've seen co-production be put before the development of a service model, and keeping the service model as a live document that gets reviewed and practices reviewed, and how that is understood and how that is developed to better support people who are accessing services. I'll go to my last slide, which I think is also an important one, and that is to understand that people who are coming into services are more than minions. And this is a little image that was collected as part of a data collection process around continuity of care. And I think it's, even though it's a simple little diagram, I think it's hugely telling of what happens when people are included, when there's a sense, when people have a sense of belonging, and when people are understood as being part of the change. So I'll throw back to you, Katie. I think I've probably used up my time, and I'll stop sharing.
Thank you so much, Bradley. It's so fantastic to hear such an array of interesting examples of co-production in practice. I'd now like to invite our next panelist to join us, Dr. Grenville Rose. Since 2007, Dr. Rose has worked in research and evaluation with a number of community managed organisations, having previously spent 6 wasted years working in commercial food preference research. Those are, of course, Grenville's words and not mine. Although much of it is a distant memory, Grenville identifies as someone with lived experience of hepatitis C, problematic substance use, including injecting drug use, and mental health. Thank you so much for being here, Gren.
Thanks for your kind words, Katie. Yes, well, I was reflecting as the other speakers were talking that, yeah, they really were wasted years in many ways. What I was doing in commercial market research, so I've got a very mixed background. My PhD's in the development of human food preferences. I'm a registered psych, and yeah, the undergraduate was in psychology. And the consumer food preferences, which I did because someone gave me a scholarship. I didn't have a major interest in it, but it's a very applied area. So you wind up working, excuse me, in commercial market research with companies like Kellogg's and Jim Beam and Coke and Woolworths. They're all clients, and a company called Simplot that does Edge or Birdseye are our main clients in the day. But what it is purely using people to gather data and gathering data to sell people stuff. So yeah, we used to present food and people would come and participate. We'd pay them money. We got into schools very easily because we had money, and schools, as opposed to doing my PhD and finding out something more theoretical, was really hard to get into schools. Easy with commercial when we wanted in with money. And that's it. So my only contribution in that time, really, aside from making various products that you've probably eaten taste better, is that I used to occasionally throw in the word consumer. People instead of consumer, because they're all the time talking about consumers, and I wanted the people that were doing this to recognize that we're selling stuff to people in the end, and not necessarily making a positive difference in their lives, let's say, doing what we're doing. And that was purely, I was one of the gurus in the area, especially children, for my sins. I was wheeled in and out as the expert, and I had total control over what happened in the research, which is, so you see, in so many ways, it's the opposite of what we're talking about here. I certainly had the power. I was the dude, believe me, in that. And so my recent work experience, as Katie said, I've worked mainly in community managed organizations and NGOs, mainly in mental health. I've worked for a couple of peer-led organizations as well, which has been great. I've always been surprised that New South Wales Health funds organizations like Newer, for example, but they keep on doing it, and that's a good thing. And we need more of it, essentially. Now, and from that area, from the hepatitis C area, in fact, I've been thinking of a phrase while we're sort of developing today's talk called the affected community. And in hepatitis C, it's used a bit sort of differentially, like it's a bit mixed. You don't know whether they're referring to people affected by the illness, or in the case of hepatitis C, or people affected by what you're doing, to support. But today, I want to use the term affected community for the people that we're here. They're affected by what we do. So what we do either in research or what we do as service organizations, we're affecting other people's lives. And I think that's a really important thing to remember every time we go to do something, at least in the back of our minds, trying to be mindful. And that's the responsibility that we have. And also thinking of that responsibility, then the only really fair way of going forward is to involve everyone that you're going to affect, or the community you're going to affect, at every stage. So trying to make sure that the focus of the research, for example, you're going to do, we're talking about research today, gets the best result, gets best results in the community. Then the way to focus the research, the way to find the proper questions, is to talk to the people who are going to be affected by it and see what the issues they're having are. And that's not research. You have to involve them in the research to direct the actual research when you go out broader. Number of issues in that, not enough time today for it, but you've got to have people involved from the start. I'll talk a little more as well a bit later. Looking at ethical conduct. So when you're conducting the research, you want to go through ethics. Okay, you go through university ethics. That isn't the be all and end all of ethics. They're only looking at certain things. Again, if you want people to be treated reasonably as you're going, as you're conducting your research, if you want how people are feeling, if you want to take care of how people are feeling, how people feel treated, then again, involve the community. Nothing else makes sense. Reporting and interpretation of the results. Again, people, even well-meaning researchers often doing social research, interpret the results and report the results in a way that's actually harmful to the community without meaning to. To me, it's a very interesting point. You can do damage entirely, you know, the road to hell is paved with good intentions, and sometimes it is. And part of it is reporting on the negatives. You're just reporting on the disadvantage, on the disability, and all the negatives of the community that you're working with. And it's really important to remember the strengths and report on that. And again, having the different eyes, having different viewpoints as you're doing the work is always going to make it easier to take that into account, to take the community into account, and to treat the community well, and to show the community in a decent light, which has been a problem in research in the past. And those problems are the same across mental health and AOD, or those solutions, if you like, are the same across mental health and AOD. There is stigma surrounding mental health. There's a lot of barriers to people getting into research that are around mental health and AOD. But I think there's specific barriers to alcohol and other drugs as well. There's extra stigma in alcohol and other drugs. One of the things that people see for people who have substance use issues is they're doing to themselves. Oh, you know, you only got yourself to blame. Just say no to drugs. Why don't you stop? Okay, that sort of works for mental health too. Why don't you just cheer up? Yeah, all right. But there's extra stigma with alcohol and other drugs because of that, because people see people are doing it to themselves, which of course isn't true. The people who are saying that, people who are thinking that, are not people who've walked even a mile in your shoes. They're not people who've walked, certainly not people who've walked every mile that you've walked in your shoes. They don't know why and haven't really thought about why you're got substance use issues. And that's where you need, again, people on board. And but it's a barrier to overcome. I have seen people anonymized in their contribution. I understand that. Not everyone's able to sit there and say, I mean, for me, I used to be an injecting drug user. But then again, I'm not anymore. That's one thing, allows me to say it. Two, I'm an old bloke, I'm middle class, Anglo background, educated. So I've got a lot of things, a lot of resources, if you like, a lot of social resources that allow me to say that. But it's a barrier for some people in particular. And it's also a barrier from both sides. There's some researchers that aren't going to cope well with all of that as well, particularly for people who are currently using. There can be consequences of being identified if you're a current user as well. And that comes from not just legal consequences, but it comes from the researchers who might immediately disparage your contribution. The other thing about mental health and AOD, excuse me again, it often scares me. It's been so wet lately, it's been getting to me. It often scares me when people say how far we are ahead in mental health. As I said, most of my work's in mental health. And I keep, when I'm talking with people in AOD, they say how far we are ahead. And that scares me because I know how far we've got to go in getting to this point where we have this inclusive research, where we're having different viewpoints represented in research. And I was talking with a peer worker a while ago. I've been a peer worker in AOD for the last 30 years. And they said, I thought it was all done in the early 90s. And it just hasn't changed. I'm not sure why that is, but I thought it was really, really disappointing comment. So I think things are changing just a lot slower than we like. But we aspire to more, don't we? More on aspiration a bit later. So there are difficulties to involving people with lived experience at all stages of research. A couple have been touched on by earlier speakers. Consistent funding is one of them. I mean, trying to find funding research that's consistent and long-term is hard enough, but trying to fund people with lived experience background and make it consistent, which is important, and long-term, just doesn't happen enough or very often. And what we've got to do is try and convince funders of the value of funding people to work as lived experience researchers. The Kickstarter we've designed to give, as I understand it, both a rationale for doing it and to help with a framework to accomplish it. So the reason for doing and roughly how to do it. And it's a Kickstarter. It's not designed to be the entire answer. There are more readings, as I think Brett talked about. And there's a lot to do. There's a way to go in many senses. But overall, I think the aim should keep us going. What we're after here, as my understanding, is more ethically conducted, better focused research that is more meaningful for the community, that aids the community, that is affected by what we do. Remember, at the start, we're affecting people's lives. And it's something we've got to bear in mind at every stage. And also, I think I saw the word fun there earlier. This is a really important word to me. And it's more fun. When I've worked with people with lived experience on the projects that I have, or with peer organizations, peer-run organizations, I've had more fun, frankly. And fun's important. I say this as a psychologist, it's important to have fun. So, okay, I think that's about all I've got for the moment. I will be back, and I'll throw back to Katie.
Thank you so much, Gran. I actually wanted to bring back Joe to elaborate a bit on a point that you raised in terms of Gran's fears of where we are and where we need to go. And I thought, Joe, as a conventional researcher, where do you think we are with co-production research, and where do you think we can go from here?
Yeah, thanks, Katie. I think it would be very fair to say, and I think these are things that have been put forward already by Brett, Bradley and Gran, is at this point in time, people with lived experience are more often likely to be recruited as subjects in research or consulted in probably fairly ad hoc, tokenistic ways. So being asked to voice their perspectives, which might be heard, may have some influence over a research project, but really the person with lived experience has no real power in that discussion. Those ideas can be picked up or not picked up by conventional researchers. So there's really no power over the research questions, strategy, analysis, the way the research is disseminated. And I think Gren's really picked up on that. The dissemination process itself can be potentially harmful, and we really need to be thoughtful. And I think there are times when I've worked with people with lived experience who've actually said to me, I became so angry, I was reading the research and it was just so painful to read because I couldn't read myself in it, or I was reading a perspective about me that is a very perspective that I'm struggling with. But so I think despite calls for change from disability and consumer movements, as well as key organisations like Mental Health Commission, NHMRC, Health Consumers New South Wales, all of these organisations, ComDARN as well, power is still very much in the hands of conventional mental health and alcohol and other drug researchers. And I think the status quo is really held in place by lots of different forces and factors. I talk about some. I mean, there's a whole literature on the kind of forces and factors, some brilliant writers who've written about some of the problems here. But conventional researchers really are trained, I think, within a disciplinary paradigm. And I'll own it, we're continuously invited into the idea that our own knowledge and our own disciplinary perspective is more real, more valuable, and this idea of being more objective, which really implicitly and sometimes explicitly means that we position people with lived experience and the knowledge of lived experience as naive or inferior and biased, and people often explicitly say those things. So of course, it's not only ignores the histories and traditions and biases of our own disciplinary backgrounds and some of the backgrounds and histories of that conventional researchers have often unexamined, and some of them are deeply problematic. And it also overlooks the value, brilliance and vitality of lived experience positions for understanding and remaking knowledge. And I think that to me is the crunch point. It's actually realizing, I think Gran says fun, it's also just, you know, you really think you've understood something, you understood a question, understood an idea, and I'll sit in a room with people with lived experience and we'll actually have to completely re-examine what I think because of that lived experience positionality and where the person with lived experience looks at the problem in a sort of fundamentally different way from the position of having lived that, and also considering those theoretical and those ideas within that particular discipline. It actually can be a complete reframe for the conventional researchers. But it also overlooks, I think, the considerable expertise within the consumer and peer movements, which have been built over centuries. I know this is something Brett has spoken about. When people lived experience of mental and emotional distress, I mean, that's one way of talking about it, or trauma, or psychological diversity. We could talk about that in so many different ways, or of drug and alcohol use, have come together and dialogued, thought together, written together, practiced new ways of doing and living. And I think there's a power in that knowledge that's been built up over a considerable time that a lot of conventional researchers is just not tapping into. And I think we have some clear examples of how powerful and important that knowledge and that history is, because it has influenced contemporary thinking in health services and drug and alcohol and mental health sectors around, you know, what do we mean by recovery, what is the impact of trauma, what do we mean by harm. You know, all these things have been reconsidered in ways that have been quite influential in services, but often, again, I think within research and services, people forget those origins, forget that those origins actually come from lived experience movements. So I think for conventional researchers to really shift and engage with lived experience knowledge, it means that we have to actually reimagine our work. And as Edgar Khan suggests, it means shifting from the idea of being the providers of knowledge and the sort of holders of knowledge, and the idea that people with lived experience are passive and dependent upon that knowledge, to really moving towards a relationship of mutual, respectful, equitable partnership, where the knowledge of people lived experience and the broader consumer movements and peer movements, consumer survivor, ex-patient movements, is really central to decision-making and action in research. So, of course, although it's important, it isn't just about what conventional researchers do or don't do. And I think Brett spoke about this, and Gran as well. It's also about systemic factors that exclude people with lived experience. You know, for example, research institutions and funding agencies that continuously focus on particular kinds of credentials, educational credentials, or traditional metric-based track records, which really don't recognize lived expertise and create barriers for employment and grant funding. You know, and also just like a real sort of emphasis on, well, this is a method, we need to do it in this particular way, and you know, otherwise I won't get published in this particular journal. And that's actually can be very damaging for opening up bigger questions about, well, maybe the way we've been doing things isn't a really good way and doesn't actually serve the communities that we're intending to serve. So I think another issue, I think, for conventional researchers and disciplines more broadly is the inflexibility and or sometimes the lack of will to reconsider what we do and how we do it, and sometimes disciplinary protectionism and the desire to maintain disciplinary dominance in this area. So, you know, not listening to the kind of critiques from lived experience movements that are, you know, out there and accessible for us to, you know, reimagine, rethink. But I also do think, and I think Bradley's really shown some ways that research can be reimagined, and co-production is being taken up. It's been taken up in the field of mental health, alcohol and other drugs, and particularly in the field of disabilities, which I think maybe feels like it's ahead of the world of mental health, and which, like I think Gran spoke to, means that, oh gosh, we've still got so far to go. But there are pockets of excellence and work that's happening, and Bradley gave some examples. Brett and I have been working with conventional lived experience researchers. We're really interested in how do we foster this? How do we move people to this high level of participation? And so we set up an initiative with other researchers called Raising the Bar, which actually includes researchers from Black Dog, community organisations, health services. And it's really, it's tried to create a sort of model of that would support people to engage in a research partnership. We did that through providing training, mentoring, peer learning, and Brett mentioned the co-learning space, and facilitated actual experience in co-design or co-production research teams. So conventional and lived experience research are being brought together to really purposely start that journey together and successfully work together. So I guess through this initiative, we've been really fortunate to see some great examples of people working together in, you know, people with lived experience and conventional researchers. And that's conventional researchers and people with lived experience across community, clinical and academic settings, who are really trying to use the principal practices of co-production in the work. So an example of how this influences the work, I guess, is just to give you one example. We have a team of researchers that Brett and I have been working with, who half of the people are people with lived experience in the team, and they're involved in a project that was really driven from the community. So the community came together and talked about, well, what is it that's important for us to know? And the priority was exploring skills and strengths, not just the challenges. So that double story of people's experience of people living with neurological conditions and psychosocial disability. So the research not only had the focus on the strengths as well as the skills and challenges, it was also concerned with not just speaking to clinical and academic audiences, but also speaking to affected communities about recovery strategies. So if I can convey the skills and knowledges of other people in this area that can support people who maybe recently have just received a diagnosis or just beginning to understand the situation or circumstance that they found themselves in. And also skills and knowledge about how to navigate health systems, knowledge about what good healthcare could look like so people don't get gaslit when they go into services, and how people might advocate for really good quality care, both individually and collectively. So we see a very different kind of research program or strategy or agenda, if you like. And the teams, also that team's link to community means that not only that the ideas or questions come from the community, but also the research can effectively disseminate back to the community really quite easily through those community networks that team uses traditional and non-traditional means. So speaking to community members, as well as speaking, traditional presentations and publications to influence practice models of care and broader research knowledge. So yeah, I guess through the work with Raising the Bar, we've seen that the shift is possible. It does need to happen. I think it's a necessary shift, and I think I'm hoping that at some point in we'll look back at our culture of research culture and think, gosh, back then we used to do this thing where we would research without people. Isn't that odd? Because I guess that's the kind of culture I think we should be moving away from, and to move towards something different that is actually really attending to people with lived experience as the people who are most have the biggest stake in what we do and the impact of what we do in terms of policy and services. So I'm going to borrow from Arundhati Roy and say, I don't think it's not only possible, I believe it's on its way. And as we realise and correct our mistake of exclusion and realise what we have to gain from high-level participation with people with lived experience, as well as from lived experience-led research, I think practices such as co-production will become the new normal in research-driven policy and services. And I think, of course, that requires action. It's not just about goodwill. It's not just about being nice. It means about rethinking our research practices and paradigms, rethinking how institutions measure and fund research, as well as ensuring that the necessary resources and skills to support both lived experience and conventional researchers. And so often people focus on, oh, lived experience researchers need more training. Actually, I think Brett and I have done quite a bit of work around this, and what we're finding is actually the conventional researchers need training and supports and skill development in this area too, because it's actually quite hard to shift the way research has always been done. So I guess we're hoping that the Co-production Kickstarter guide, which we made in collaboration with CMHDARN, is one small contribution among many to that change. And yeah, it doesn't answer everything, but it maybe supports people to get started.
Thank you so much, Jo, and it's so great to hear about the great work of raising the bar, and I think everybody here is looking forward to seeing where that leads to, and yeah, so much hope sitting there. I'll now like to invite all of our panelists back for a nice little Q&A session, and my first question is for Gran, and that is, why aspire to this framework?
Aspire. Yeah, I like the word aspiration, and because it says that, well, you can start. I think I'll kick off with my old French teacher. He said, any job worth doing is worth doing badly. I didn't give him enough credit at the time, but what he meant was, of course, if the job's worth doing and it's a bit difficult, which I think Jo's just said that we got a way to go, then probably the first time you do it, you're not going to do that well. But the second time will be a bit better, and the third time, and practice may not make perfect, particularly in this space, but you will get better, and things will get better. And even the fun thing. So I grew up in the 50s, 60s, and 70s in Australia. Inclusion wasn't even a word, as far as I know, in those times. And yeah, my background in commercial food research, that wasn't inclusive. That was just me running stuff. It's been really good to work, and we've mentioned power as well, just to give up that power of being the one. I really felt in those days like I was wheeled into the room as the expert, on the suit and tie and everything. Haven't worn a tie since. You're wheeled in as the expert. You're the one that knows what's going on, and everything happens because you say in the way that you say it. Wasn't comfortable with that. I've had much more fun, and I've learnt a lot more by sitting down with people and learning stuff from others with different backgrounds and different experiences. And that's been, as I say, I'm almost drinking in the learning at times. It feels great. I got a long way to go, but it's more fun, it's more worthwhile. And you should, from what everyone here said, get better results for the community that we're here to support.
Great, thank you, Gran. The next question's for Brett. What are some common misconceptions or mistakes that are made in people's approach to co-production?
Sure, yeah, and I'm happy to answer that, but I also saw a question pop up from Louise. And I guess I wanted to answer that because I feel like I am a person here solely as a lived experience person, Louise. That is my expertise, that's where it comes from. My personal experience is in what I call distress in extreme states, not so much in alcohol and other drugs. But yeah, that's where my expertise comes from, and I use that expertise in my work as a researcher, a lived experience researcher. I'm not a researcher with lived experience, if that makes sense. But to go back to your question, Katie. Well, so I've got a few things that came to mind when you were asking your question, Katie. I think I've written down time, resources, and honesty. I think I'll start with honesty. And I think I wrote down next to that, are we there yet? Like the kids in the car, are we there yet? And I think it's that's an important question to be honest about, that maybe your project or your initiative won't reach that level of co-production because decisions were already made back in that co-planning stage before you could get people with lived experience on board. And yeah, it's much better to be honest about, okay, the most we can aspire to here is the level of consultation, than pretending that you're working in a co-design or co-production framework, because that just sets everyone up for a real bad time, and also really doesn't just diminish your work. I think it actually diminishes real co-produced research generally. I wrote resources, money. I don't think I've met a researcher who said I have all the money I need. I think we're all working in systems that don't give us very much to work with, and that's okay. But I think that whatever system you're working in, a step you can take to support meaningful co-production is to start advocating for a paid participation policy for people with lived experience. I know that won't be a foreign concept to many of our audience, but perhaps for some, that can be an important thing. And I think in my experience, through Raising the Bar, we brought people on as research assistants into the university system, which is a big deal, right? Like it's a lot of paperwork and tax file numbers and navigating those pay systems. But I think it also gives people some really valuable intangibles. A person could then put on their resume, I worked as a research assistant for Sydney University between these dates. They also, can access the library and all other sorts of like little non-financial benefits that are really, like I said, intangible, but can be really vital in supporting people to go on and build that capacity. So I won't talk too much more about money because I'm sure we could have a whole separate webinar about problems in resourcing and funding research in Australia. I think the last one I want to talk about is time. Co-produced research takes time, and I think that's one of the reasons why people struggle to move up the bar. It's not that traditional ways of research are necessarily super easy either, but I think they're understood and timetables can be given. Whereas you've got to spend a lot more time on, again, those intangibles, the things that aren't widely valued by funding bodies, building relationships, doing community-based needs analysis, finding the questions that are important to affected communities. These things all take time, building those relationships, building trust, learning to have those conversations together, take time. Time is a currency all of its own, and you'll likewise never have enough of it when doing co-produced research. I think, Joe spoke to this idea that the problem can lie in lived experience people, that they just need to be trained in research or trained in research methodologies. I think that's an easy trap to fall into. It's one that I fell into in my early days. But I think that we're really confronted with wider systemic issues that are, by and large, the blocks to genuine co-produced research. I hope that somewhat answered some of the question.
No, it certainly does. Thank you so much, Brett. My next question's for Bradley. What's new about the approach and how might it affect service delivery practice approaches?
Before I answer that question, I'd like to go back to what Joe was talking about, and that is allies, allies to co-production. And I remember, and I'm kind of like comparing my historical experience back in 2012, which is now 10 years ago, to now, and what I'm experiencing much more embedded in a co-production space, and working in a way that I kind of know what I'm doing. Whereas back in 2012, I sought out some support from an academic researcher by the name of Professor Beverly Raphael, who is absolutely a national treasure, now deceased. And what she said to me when I first proposed what was consumer-led research, which effectively was co-production research because it was done in collaboration with a whole bunch of other people, but not in a very knowledgeable way. And she said to me, well, Bradley, you go off and do that because you go off and do that and I'll be here. I will hold the ground for you to go and do that thing. And that will provide the flexibility and the agility for you to move through the space and do it in a way that is effectively friendly to the people who you're involving in the research and how you're collaborating with those folks. And I thought that that was a powerful ally experience back in the day that came forward in a landscape where it was very difficult to write consumer or lived experience in the same sentence as researcher. So I do think we've come some part of the way, and I think the Kickstarter, Co-production Kickstarter validates that we have come some part of the way, but we've got a way to go. When I compare what's happening now in regard to lived experience inclusion, particularly in the CMO area, and I'll use the example of this work that I've been doing with young people and youth aftercare. How I think it shapes service delivery is that if we involve people who are accessing services to tell us how it is and what it is that they want, and they actually become active participants in the process of that telling and speaking, it actually creates a situation of belonging, which is a powerful antidote to the loneliness and hiddenness that is a feature of suicidality and self-harm. And I think unless we're doing that piece, we're missing a whole chunk. We never get that when people are subjects to research. How is it as a subject to research do you feel like people are coming back to you and asking you again and again, is what you said correct to this context? When we started out, were you there? How is it that we're kind of like, how is it that we're getting to know each other better in the process of doing this research together? And how does that support our further collaboration in a co-production kind of standpoint? And what happens, one thing that has remained true for both 10 years ago and now is that when lived experience data is collected, something happens in that it bleeds into the research and into service settings in such a way that everybody finds permission to speak their lived experience, and therefore the data we collect is evidential from the standpoint of lived experience, which is closest to the actual experience of what's going on around you. So it's that bleeding process that happens around lived experience, how that translates into service delivery, co-production, lived experience research, funding arrangements, when funders can hear about what's actually going on the ground and how does that make a difference from the voices of people themselves. That does something, that shifts things. That supports the Beverly Raphaels of the world to, and she was absolute gold in this. So I just want to acknowledge her deeply and give my thanks to her. That supports those folks to step back and say, go do that, got your back. I'll be an ally. I'll feed in my conventional research knowledge as it supports the project that you're undertaking. That's how it bleeds into service delivery.
Thank you so much, Bradley. I think we'll do a nice little round robin to kind of end things and just have everybody provide their top tip for co-production. I'll start with Jo to provide theirs.
Download the Co-production Kickstarter. Yay. I think I like Gren's point. I think we learn best by doing, but I guess I can't speak to people with lived experience because I don't think that's my place. But if I was to speak to conventional researchers, I would say connect with people with lived experience, organizations that promote lived experience perspectives, connect with some of the writing scholarship from consumer and peer movements, absolutely bloody brilliant. Really amazing work that has and is being done. But just be prepared for it to be disruptive. Like, don't expect this not to be disruptive. It's meant to be disruptive because it's about moving out of our disciplinary echo chambers and reconsidering ways of knowing and doing in mental health, alcohol and other drug kind of areas. But of course, because as Gren says, you know, we need to pay people. So if you haven't got the resources, aspire, don't settle, keep it in sight, you know, read. And if you have got the resources, think about how you can use them to support this to happen. We should be supporting this to happen. Some researchers are doing incredibly well, able to pull in big grants, pull in a grant that's a co-production grant, you know, to do it, get it started and employ people with lived experience. That would be awesome to see. And I also saw Natalie Cutler's question, which I wanted to ask her, which is what factors are important. Yeah, I think it's really important. If you have a lived experience and you're a conventional researcher, which means you're working from a disciplinary perspective, and you have a lived experience, your lived experience might be useful for being sympathetic to the situation of the people that you're working with, but don't get it confused. If you're working from a disciplinary perspective, that's where your power sits. It's good not to try to wear two hats in this work. People who are lived experience researchers working from a lived experience position, it's political, it's different, and it's difficult. And that's something I think we shouldn't try to speak for, because in and of itself, it's a labour, and there's a lot of labour involved, I think, in that work. That's my tip. Thanks.
Great. Gran, would you like to share your top tip?
Yeah, I did some research with someone a few years ago about learning styles in universities, and undergraduates who performed well were afraid of failing, basically. But the people who performed well in research degrees wanted to learn stuff, and didn't do so well in undergraduate, I'll add, by and large. So that's let go of the power and learn from people, I'd say. Where, you know, if you're a researcher, you want to learn stuff, well, there's people you can learn stuff from. There's a lot of people out there that can really tell you things. That'd be my top tip.
Great, thanks, Gran. How about you, Brett?
Yeah, I think for me, my top tip would sort of be prepared to be changed. I think your ideas and yourself. And I think, like, yeah, from what Bradley was saying, I think something new will emerge from a co-produced endeavour that might not have been possible sort of any other way.
Great, thank you. And Bradley?
Am I the last cab off the rank? Goody.
Yes.
I think the thing that I most want to say is that relationships with allies are critically important. Is to see that learned experience and lived experience are hugely complementary, and that those relationships need to be established and created in an ongoing way. And in order to be able to navigate the discomforting, transgressive experience that is co-production and lived experience research, but not only for that, to kind of like set the scene for healthy investigation and discovery research in places that we've never really been before in this regard, rather than getting stuck on evaluation of services, which seems to be a bit of a glass ceiling in certain areas. When it comes to the nitty-gritty of inclusion of people with lived experience, I think one of the key players in service land is supporting people coming in as potential co-researchers to understand themselves as knowledge holders as opposed to passive recipients of service. And that's quite an ask for organisations who have a history of understanding the people in our service in a particular way. It takes some courage, it takes some bravery to step across into the space of this person is a team member, not somebody who I'm intervening upon. Yeah, and because that same reflection is where people become subjects in research. So if we can hold that space, develop the ally relationships over time where there's respect for learned and lived experience, while elevating lived experience in its absence, then we're going to really be able to get somewhere.
Great, thank you, Bradley. And we've got 1 minute left, so I'm going to thank everybody. Thank you to Joe, Brett, Bradley, and Gran, and everybody for joining today. This webinar recording will be available on the CMHDARN website in a few days. We'll be sending a short evaluation survey after the event, so please let us know your thoughts and feedback. Thank you, and we hope to see you at another CMHDARN event soon. Thank you, everybody. Have a great afternoon.
Thanks.